Hey guys, so welcome to another Shackspirations with Andrea. Um, Yesterday I was very motivated to do this vlog, and I thought I'm gonna put myself together. I straightened my hair, I did some makeup, I did my notes, and it completely exhausted all my energy, and I crashed. And sometimes when you have anxiety and depression, doing things that are out of your comfort zone deplete your energy. Sometimes you just need a nap, or sometimes you just need to lay down. So yesterday I did my notes, and then I had to drive to Frankfurt to pick up a tree that I wanted for my yard. And if you know me, I have horrible anxiety about driving someplace I've never been before. So much that usually I ride with somebody. But this is the year of changes for me. And by God, I'm putting on my big girl pants and I'm trying to tough my way through some uncomfortable situations. Hence, talking about things that I do talk about, but not publicly. And driving to new places, which I did fine. I did just fine. Turned on my little GPS, went, come back, but drained me. So I thought, I'll do this vlog before I go to bed. Nope, crashed. So you get this version of yesterday's hair that I've slept on, and makeup under my eyes. And my eyes are puffy, and you know what? This is a blog about mental health. So you should get the real version of me, right? So let's talk about mental health. If you know me, and obviously you do because you're watching this, or I think I've got a couple people that I don't know that have started following me, which is cool. But I work in obstetrics and gynecology. It's my calling. I love what I do. That's why God put me here, is to help ladies with the pregnancy and their women's health. So awesome. Here I am. And the thing that I want to talk about today is postpartum depression. And I'm going to start talking about some of those uncomfortable things that happen in pregnancy that you don't hear about, or people just didn't warn you about. It's the uncomfortable things that people do not talk about. And the first topic is postpartum depression. So, you know what? You get pregnant, and if you've been trying to get pregnant, or, divine intervention, what have you, but oh my gosh, you're so excited you're pregnant. This is the best time of your life. You've got a being in your stomach that's growing and developing. And how freaking amazing is your body that women's bodies can do that. They can house this baby that starts off like a grain of sand and comes out a little person. I mean, that's fascinating. So what happens when you're pregnant and people start noticing that you're pregnant? Oh my gosh, all eyes are on you. What can I do to help you? What do you need? Oh my gosh, you're glowing. You look beautiful. You're fantastic. Can I touch your belly? Can I feel this baby kick? Oh, this is beautiful. And it is beautiful. It is a beautiful thing. Sometimes pregnancy is not beautiful, and I'll talk about that another time. But anyway, you have all the attention you could ever ask for. And then you have a baby. Your body has not been your home for the last 9 to 10 months. That can deviate depending on your pregnancy and problems that occur, okay? My first daughter, I went into labor at 31 weeks, and I had her at 36, which is not that preemie, but you get the gist that sometimes babies come early. But anyway, the point is, you have all this attention, and then you have a baby, and it kind of goes away. And that's not on purpose, because people are so fascinated with this little bundle of joy that you just gave birth to that sometimes they forget about mama. So, all these people out there, if you have a pregnant lady in your life, if your partner is pregnant, if your daughter is pregnant, if your sister is pregnant, if your friend is pregnant, my first word of advice to you is make sure you still pay attention to her after she has this baby, because mama life is not for the weak heart. And it's hard when all the attention was on you and now it's on the baby. You can be in a room full of people and people flock to that baby and mama's just sitting over there in the corner while everybody oohs and ahs, and she's over there. She's just either, there's only two ways that a baby comes out, people. It either comes out your vagina or it gets cut out. So you're over there trying to recuperate and everybody's looking at the baby, and that's great. That's great. Babies are cool and I get it. But I just want you to understand how that might look to a mama, how it might make them feel. And when my patients come back from after having a baby, I try very hard to make my first comments, communications to them about them. And usually it goes like, hey, how's it feel to not be pregnant anymore? And usually the answer is freaking amazing. The last few weeks of pregnancy stink. They stink. They are uncomfortable. If someone tells you otherwise, I'm not sure they're being truthful to you. But anyway, and then I'm like, are you getting any sleep? Because sleep is a big factor in things, people. And then once I get them back and I chit chat with them a little bit, I like to ask them if they have help with the baby and things like that. Then usually I want to see the baby. But I want to make sure mom's okay. So when we get in the room, we're going to talk about this little thing called the baby blues, which is usually the first few weeks of pregnancy. Guys, your emotions are up and down. Your hormones are all over the place. If you're breastfeeding, your estrogen levels are usually a little lower, and you're trying to heal from giving birth. And those first couple weeks are rough. They're rough. You're going to cry, and you don't know why you're crying. You've got this baby, and you're looking at it, and that bond takes time. And some people, maybe it's instantaneous when this baby comes out, but sometimes you look at this baby and that mental link that, oh, this is mine. Sometimes that takes time. That takes time. You're going to be overwhelmed, especially new mommies. You're doing something that you've never done before. Brain fog. Pregnancy brain is a thing. And just when you have that baby, it doesn't go away. Because you know what? When you're tired and you're not sleeping because you have a newborn, being tired makes you emotional. It also makes your brain not function the way it normally does. And you worry about everything. Everything. And that's normal. It's normal. The thing is, the baby blues go away. They go away. And in a couple weeks, you start to feel better. And that is the normal part of it. Women go through it. It's natural. When it doesn't go away, that's when we have the issues. That's when we start crossing into that postpartum depression. Okay? So you have this new baby, and the first few weeks have passed, and you're still crying. You're crying all the time. You can't stop. You have no motivation. Your moods are up and down, up and down. You start having these thoughts, I'm not good enough. People would be better off without me. What am I doing with this? What is this? What is this baby? I don't have a connection at all with this baby. I look at it and I don't feel anything. I can't get up. I don't have the energy to get up. I'm ashamed because I'm not connecting with this baby. Things are difficult. My body does not look like my body. I have body dysmorphia. Your body doesn't go back to the way it was overnight. It's a process. It's a hard process. And ladies, the world puts these expectations on you that you're supposed to look a certain way, and your body's not been yours for the last 10 months. And you've had this baby, and guess what? Your body's still not yours. It's still not yours. And if you're breastfeeding, your body still kind of belongs to that baby. Or if you're pumping and feeding through a bottle, or if you're formula feeding, which is fine as well, you still have to be on top of all that. So you're doing all these things, and you just feel like you're not in control of yourself. This little person is in control of yourself. 1 of 7 women have postpartum depression. 1 of 7. And only 15% of that 1 of 7 will actually seek out medical help for their postpartum depression. So, and then if you're a first-time mommy, I think the average is 7.3% of first-time mommies have an increased risk of postpartum depression. And then if you are already predispositioned for anxiety and depression, guess what? You got a higher risk too. So what do we do about all that? The first thing, the first red flag, if you start thinking people would be better off without me, I don't feel anything, I want to make myself feel something, so you start to hurt yourself, or you start having those thoughts about hurting yourself or killing yourself, or you start having thoughts about hurting your baby, that's your red flag, people. That's your red flag, and you need to contact somebody. You need to talk to your partner. You need to talk to somebody that you're close to. You need to call your doctor's office. Remember, the first few weeks, it's normal to be crying and detached and a wave of emotion, but it is not normal to think about hurting yourself or hurting somebody else. So that's your first red flag. You need to search for help. So you go back to your doctor's office at your 4 or 6 weeks postpartum visit, and your nurse, and hopefully she's an empathetic nurse that I like to count myself amongst, and they want to make sure that you, mom, you are doing okay. So we sit down in a room and we start talking about anxiety and depression. And we have this little thing called the Edinburgh scale that we use. That's what we use in my practice. Other practices might use something else. And basically it's a scale of how you feel the last week. So if in my conversations with a new mommy, if I get the feeling that they're struggling, I might give them an Edinburgh's scale, or I might simply just ask the questions and try to get a feel for myself how this person is doing. And if they're not doing so hot, I will go tell your doctor that you're not doing so hot, and then we have a bigger conversation. Or sometimes people will come in and say, I am not me, this is not getting better, and I need help. So you people that are around these new mommies, you need to know the symptoms and you need to help. And mommies, you need to let people help. That's a hard thing too. I had more of the anxiety issue with my postpartum, and I didn't want anybody to help me because I didn't think anybody could do anything right. So you go into the office and you talk to your doctor. I'm struggling. What can I do? Are you getting sleep? Because if you're not getting sleep, it makes you emotional. It makes your thought processes janky, and it takes a toll. And it can take a toll quickly when you have a baby that's waking up every hour, every 2 hours, and you're not getting solid sleep. And I like to tell my ladies that when you get a solid 4 hours sleep, you start to feel like a new person again. And sometimes that's in the first couple weeks. Sometimes it's not for the first couple months, sometimes even later than that. Babies are different. But not getting sleep is hard. So try to have a support person. And I know that's not possible for everybody. But if you have a baby partner in your life, you need to trust them to help you. Your parents are in your life. Friends are in your life. Try to have a connection with somebody to help you and let them help you. There will be times that this baby is screaming its head off and you don't know what to do. It happens. Mommies, you've all been there. I know you've all been there. And you feel like you want to rip your hair out. And if that happens several nights in a row, it's torment. There is nothing wrong with handing your baby to someone you trust and saying, I need 15 minutes of me time. I need 30 minutes of me time. I need to walk away so I don't lose my ever-loving mind. I need to go outside where my brain can be quiet and take a breath and calm myself down and focus on me. So have that support person and realize when you're starting to struggle. Partners, friends, listen, watch. Do not make people feel bad because they're struggling. Mommyhood is not an overnight thing. It's not a light switch that just flips. It takes time. Do not be so hard on these new mommies. Instead of being a martyr on your soapbox, making people feel bad, step in and help them. That's what people really need. They need help. Breastfeeding is very easy for some people, and it is a freaking full-time job for others. And when you have a new baby and you're having trouble breastfeeding, or you're having trouble latching, or you're having trouble keeping your supply and your demand up, it can drive you nuts. So there's these lovely things called lactation consultants. Reach out to them. Most practices that deliver a baby, the hospitals that they're associated with, have a lactation consultant. And I suggest, if you are struggling with your breastfeeding, reach out to that lactation consultant. Because when you're so obsessed over feeding this little baby and things aren't going your way, and you have a hungry baby, which makes a cranky baby, which makes a cranky mama, which makes a tired mama, you need a little help. And those lactation consultants are trained for that. And there's tips and there's tricks of the trade. And just remember to advocate for yourself. I'm struggling. I need help. Breastfeeding's not easy. What can I do to help? Call your doctor. If you don't know that the clinic has a lactation consultant, call and ask. I'm having trouble. This is driving me nuts. So your doctors and your nurses, they're there to help you. And that's why we went into this business. Trust me, nurses, especially nurses, don't get paid a whole lot. They went into this because it's their calling. So reach out for help. Family, partners, friends, take pictures of that mama. She doesn't feel like herself. She doesn't feel beautiful. She feels, and someone's going to come at me, but I've breastfed 2 babies. Sometimes you feel like a cow. And all you do all day long is milk yourself. And the miracle of lactation is amazing, but it's work. It's work. And those people that it has come just second nature to them, and it's great. That's wonderful, and I am so proud of you. But other people struggle, and that can lead to a little depression too, okay? So just be aware of that. Offer to help these ladies. Do you need 20 minutes? I can watch the baby for 20 minutes. Why don't you go take a power nap? You want a new mama to love you? Let them sleep. Let them sleep. Talk to them. Listen to them. Ask them about them. So you went into your doctor and you've either said, I'm struggling, or we've come to the conclusion that we think that you're struggling. So this is what most doctors are going to recommend. They're going to recommend therapy, maybe giving it just a little bit longer to see if this is just not a sleep deprivation thing, making sure that you get a little help, just a little extra time, or they might even recommend medication. Or a combination of both. Mommies, I know that your life is now completely devoted to this little living being that's on the outside, But if you're struggling with your mental health, I do recommend therapy. And in my practice, we have a list of therapists in the local region that we send people to. And then, guys, there's some therapists out there that specialize in postpartum depression. And then you need to find a therapist that you mesh with. And typically, I think you should know that you mesh with your therapist in the first couple of visits. And if you don't mesh with them, get another therapist. That is time wasted if you do not mesh with your therapist. Find somebody that you are comfortable talking with. And a lot of times, if someone's not ready for medication or that's not the path that they want to go down, that's fine. That's fine. Medicine's not for everybody. You come into a lot of opinions when it comes to mental health and medication. A lot of times I'll tell these girls, if you need anything, if it's just a talk, just call me at work. I might not get on the phone right away, but I will call you back and we can just chat. We can just talk on the phone. And then there's medicine. And if you are wanting the medicine route, make sure that when your doctor knows that you are breastfeeding or not, because they should already know, because they should have already asked you. But, that kind of falls into the category of what's safe while you're breastfeeding and things like that. That's just good information to talk to people about. And sometimes people don't tell their OBs that they're depressed. Sometimes they'll go back in 2 months and tell their family doctor, their primary care doctor, and just make sure people know whether or not you're, breastfeeding or not. But make sure you're getting help. So if you've hit the baby blues, which is fine, that's common, it happens, it's normal. It's normal to cry and not know why you're crying. But that part, it phases out. It goes away and things start to get better. If we've went past those first few weeks and it's not getting better, that's when we're talking about the postpartum depression. And you know what, ladies? That's normal too. It's normal. You are not alone. It is normal. And then if you struggle with that anxiety or depression, even before you've had a baby, learn your warning signs. So, mental health matters. And one aspect of mental health is postpartum depression. And there is a lot of stigma around mental health. And there shouldn't be. There shouldn't be. It is a common issue that happens to a lot of people, whether it's anxiety or depression or bipolar. It's not something people have done to cause this to themselves. It's something that happens. You go through struggles with your life, and sometimes it's situational and sometimes it's not. Sometimes it's hormone imbalances in your brain. It's nothing that you've done to make it happen. It's normal. It's natural. And I think we're at a place, it is 2021, that we need to quit treating people like they're leopards that are struggling with their mental health. I think it needs to be something that we can openly talk about. There needs to be a better focus, especially here in the States, on mental health and mental health education. And I think if we did that, it might be a better world out there. It might be especially a more compassionate world if people realize that it's normal and didn't treat people differently just because they struggle. I might struggle with anxiety. You might struggle with eating. You might struggle with focus. There's different things, but there needs to be some normalcy in the way that we talk about these things, because it is normal. And I'm sorry if you're telling someone it's not normal, you're wrong. You're wrong. It's normal and people struggle. And if it was treated differently, then maybe people would be more apt to talk about their mental health when they are struggling and get help instead of suffering in silence. So that's my little spiel. I hope you liked it. I have a couple of things coming up that I'm super excited about. I have two things that are following. One is gynecological about sex and proper hygiene and things like that. And I have another one that is pregnancy related that will go down this road of sometimes bad things happen. And that's going to be another one that I think those are going to be just really, really good. So stay tuned. Hopefully I'll get those out soon. I've got to kind of touch base with the people that I'm going to have guest hosts for those. And I'm really excited about that because I like to just chit chat, and I think those are going to be fun episodes. So, but I hope this was a little enlightening. If you're pregnant, I hope it helps you. If you know someone in your life that is pregnant, I hope it gives you some tips to help those new mommies after the baby's here. So, but anyway, I hope you guys have had a wonderful Memorial Day weekend. It is Memorial Day now. Remember a veteran today. Remember those people that are no longer with us. And don't just make today just about hamburgers and hot dogs on a grill. There's meanings behind it. So anyway, you guys have a blessed day.